You're listening to the Bridge podcast, brought to you by Bridge, New Frontiers in Type 1 Diabetes.
Hello, everybody, and welcome to kick off none other than one of the legends himself, Professor Steve Edelman. Now, I could spend the next 10 minutes talking just about Steve and what he's done, but I won't do that. So, Steve, if I may address you as Steve, would you like to introduce yourself, your affiliations, and everything, and that's all right?
Yeah. Well, thank you, Partha. Well, my name is Steve Edelman. I developed type 1 diabetes when I was 15. And as I grew up, I wanted to be a diabetes specialist. So I did my fellowship training at several different locations. And I've been at UCSD doing clinical research, patient care for the past, believe it or not, 30 years. I started the not-for-profit we'll talk about called Taking Control of Your Diabetes when you were just 10 years old. I saw that in the notes.
I wish I was 20 years old. I wasn't 10.
Someone typed the note. So currently I work at the University of California, San Diego. I work at the Veteran Affairs Medical Center, and I really enjoy the teaching aspect at this type of my career. I'm not as active in clinical research as I was when I was your age. And then started Taking Control of Your Diabetes 30 years ago. And that's been an awesome part of my career, educating folks with diabetes and healthcare professionals.
So, I mean, I find it fascinating. I don't know how much impact it had on your life, but I think you obviously had the experience of living with diabetes, type 1 diabetes. So your personal diagnosis and journey to become an endocrinologist, do you think that's had a bearing as to your journey of travel, so to speak?
You know what, Partha, a lot of people ask me that, and I think it happened subconsciously. In 1970, I was the classic thirst, urination, DKA, thrown in the intensive care unit. And as I got older, it sort of dawned on me that I want to become a doctor. And then I sort of leaned towards endocrinology and diabetes. And I trained at the Joslin Clinic in Boston, which was the place at the time. And so it occurred naturally. But I'll tell you what, I do have a special empathy with my patients who live with diabetes. And I share that with them, almost exclusively. And I think especially type 1s, and I was diagnosed in the dark ages. I've always thought about this. In 1970, we had urine testing. I was on 1 shot a day. And that's what they had when they discovered insulin. They had urine testing and 1 shot a day. And my doctor didn't know that much, Partha, about diabetes. And so I was put on NPH and regular once a day. And you can imagine that really did not do a good job. And I had symptoms of poorly controlled diabetes for about 10 years. I didn't know any better. My mother didn't know any better. And that sort of was the spark to say, hey, I want to spend some time educating folks with diabetes to take a more active role in their condition.
And obviously, you briefly touched upon when you were doing introduction about one of the big passion of yours, the taking control of your diabetes, the TCOYD. And you got nearly 11,000 or even more subscribers on YouTube, some fabulous videos. But I think for those who are more uninitiated into it, I find it a fantastic resource, and I'm slightly biased. From your point of view, what made you initially motivate you to set it up, and what's been the sort of history behind it?
Yeah, here's the history. I was a very young doctor, and the Diabetes Control and Complications trial was just published. Now, you're not going to believe this, but you do. Before the publication of this huge, probably the most important study in type 1 diabetes to date, before it was published, many doctors just said, well, there's no data to show that if we go through the hassle of controlling our patients' blood sugars, that will do anything good. And this study clearly showed that, you go to the hassles of controlling your patient's blood sugar, you can prevent and delay the progression of diabetic complications. So after the DCCT was published in 1993, I said, okay, let's see how we can take these messages to the healthcare professionals of the country. And things were not changing. I didn't think that diabetes care was improving at the community level. So in 1995, 2 years after this big study that was almost 10 years old was published, I said, you know what? Not enough information was going to the people living with this condition, the people most affected by it. And you know what? To be honest, I kind of was frustrated with professional education. I felt like they weren't picking up this information. You know how it is when you graduate your training.
Yeah, and you.
We know we want to hit doctors before they graduate because they get stuck in the mud. And that's when I said, I want to take the messages to the people most affected. And that was the beginning of taking control of your diabetes. 1995, in our very first conference at the San Diego Convention Center.
Wow. But, I mean, I'm a big believer in, and I've learned it. If I'm very honest, I think it'd be completely false to say that I knew about it the first day I was a doctor, because, in medical school, the teaching is very didactic. It's like you see somebody, you need to give them X and Y, and off they go, and life goes on. And I think as you've grown older, and I've learned that self-management is where the key sits. So from your point of view, I think, do you feel that the TCOYD has been also not just about the people living with diabetes, it's also been aimed at the healthcare profession to get that sort of view across, guys, what can we do to help self-management and with education?
That's a great comment, Partha. You know what? From the beginning, I always like our mission statement says to educate people with diabetes and their loved ones. I'm not and to take a more active role in their health. And it's really about education. And, as you see your doctor once every 3-4 months, if you're lucky. Access is bad these days after COVID. And, you're living with your diabetes 24/7. You should really know what to do, and you should be educated, and your loved ones. Because sometimes, as you know, the partner cares more about diabetes than the person with diabetes. But I think it's a good model for healthcare professionals. And as time went on, Partha, as I said, our mission statement was really focused towards people with diabetes and their loved ones. Then after about 10 years, I said, okay, I think I need to go back and also educate healthcare professionals. So I'm a big believer in the information comes from teaching institutions, research institutions, and it should be a parallel approach. You educate people living with diabetes and healthcare professionals, and it creates a much better communication between them. So, people are asking the right questions. Healthcare professionals love patients that are engaged. And so I think they have to be educated in parallel. I saw that little smile on your face. What were you thinking?
Well, what I've really enjoyed watching someone is the humor you bring into it. I think you make it much more simple. I think it's a step away from that world where we said it has to be dry. Education has to be dry. It's got to be written bits on a PowerPoint slides and stuff. I mean, what's your view about that? You seem to have a very conscious effort to have that degree of openness and humor. Is that a conscious decision that you made when you walked through all this?
That's a great question. You know what? I'm always into humor. I'm a big believer that humor leads to information retention. I had a professor in medical school. Most of them put me to sleep. And this one was funny. And I remember everything he said, at least the good jokes. And you know what? It's part of my personality. And we call what we do at TCOYD edutainment. And I'm a big believer, and I'll tell you what, the most common comment we get from the people we touch now that we're virtual, is that we love the knowledge, but we love the humor. And you're online a lot. You're a leader really in your own right, because you're a rare endocrinologist that is able to go to social and reach a lot of people. So I know you understand that. People like humor. And some of my jokes are pretty goofy. And then I've recruited Dr. Pettis, who's a endocrinologist with type 1, and he is one funny guy too. So we have a kind of a relationship on the video where we make fun of each other. We do things like the donut challenge, the pizza challenge, and you've got to see the one we just put out, speed dating with hybrid closed loop systems.
Wow.
And each hybrid closed loop system was a different woman that works in our office, and it's funny. So, and it gives a short summary of all 5 that are available in the United States. But thank you for asking that. It's a big part of our success is humor.
Yeah, I mean, I think that's very noticeable. And I think, we are moving into the digital era, and I think it feels like, your leadership in that sort of arena has certainly helped drag a lot of people into that. Look, we can do a lot of things digitally. Do you think this is where the whole pandemic was a bit of a, silver lining, if there was possibly could be, to that cloud? Do you think that sort of opened the doors up or opened the minds of lots of people what digital online education could do?
Yeah, you use a phrase I use all the time, that COVID has been a silver lining, because for 25 years, Partha, starting in 1995, we started off with just one or two or three, but for the last 20 years, we did 8 national conferences a year. And, we put a lot of money, effort, and we got probably 1 to 2,000 folks at convention centers in different cities, 200 cities. But when you think about it, it's just a drop in the bucket to the people we touched. And we touched them. 8 hours, that was like a revival. People love hanging out with each other. But COVID came, we pivoted to virtual, and we've learned a lot about social and more short form and all that kind of stuff, long form things. I got a great team of folks, but I think it has opened the door, and as you know, it's evolving. When COVID first hit, we said, okay, let's put on a 8-hour conference online, and people liked it. But then very quickly, people don't like sitting on Saturday for 6 hours in front of their computer. So it has evolved. And, there's some good parts about the evolution. People's attention spans are shorter, but also, it has been able to have this technology reach a lot of people, including healthcare professionals, because we know that they're on, as you know, YouTube, LinkedIn, and they're on Instagram, Facebook, X, and I know you're on TikTok.
Right. So one of the things that you mentioned, Steve, it felt like a bit of a sliding door moment in the history, DCCT. It seemed like a moment whereby we suddenly understood the importance of good diabetes control. And obviously you talked about the impacts of education, development of TCOYD. Very similar moment in time seems to be with the way we are with type 1 diabetes. Suddenly there's all these discussions about, can we prevent it? Which was never a discussion point. But can we find out those who are at higher risk? What can we do to prevent them from getting into DKA? Because sadly, most of the initial diagnoses are DKA. So where do you feel that education fits into that picture? Or even from the perspective of TCOYD, where do you think that whole gamut might fit in?
Yes, thank you, Partha, for that question. Well, things have changed a lot since the DCCT. And nowadays, with a lot of therapies that are going towards preventing type 1, preserving beta cells when people are diagnosed, and even later on, beta cell transplantation. But in the prevention area, it's extremely important. We know the importance, as you mentioned, when you even screen an individual for autoantibodies, they're actually educated on the eventual diagnosis, especially if they have 2 or more autoantibodies. And we know that when people screen for studies, they prevent DKA, they prevent that big crash and burn ICU moment that I had when I was diagnosed, and most type 1s. So I think now that we understand the natural history of type 1 diabetes. We never used to talk about that before. We have stage 1, stage 2, and then stage 3 is when people come down with type 1. I think it's extremely important because we're going to be developing, we meaning the research of the world focused in type 1, we're developing all kinds of therapies worldwide that will eventually be available to individuals depending on where they live, and so on and so forth. So I think it's important. And even when people talk about what's the big deal about delaying type 1, you're going to get it anyway. Well, as you know, delaying type 1 in an area of research that we're doing now where we're even getting better therapies, GLP-1s, SGLT2s approved for type 1s potentially, not just hybrid closed loop systems, but totally closed loop systems where there's no input from the user. So I don't think we've ever seen a time in type 1 where we've seen so many advances, therapeutic, technology, and prevention. Prevention is where it's at.
Agreed. And I think that's the most exciting phase of type 1 diabetes that we have seen in a long, long time, thanks to all the academics and researchers behind it. I'm going to ask you more of a sort of question related to the TCOYD platform you have. Where do you think it might fit in?
You know what? I think it's, patting ourselves on the back, it's extremely important because think about this. We need videos, we need podcasts, we need newsletters, electronic newsletters to get the word out because you and I really don't have a reach to our patients' family members. And at this stage, that's the challenge, is letting people know that this is a condition where you can actually make a difference. And I personally believe that if you can delay type 1 for even a few years, having type 1 myself, it's tremendous, especially with all these advances we're seeing. So, the advances just seem to be coming, and pretty soon we won't call them hybrid closed loop systems. We'll call them closed loop systems. So they're a good stepping stone until we get to a cure. So I think the social media ways to reach people out there, they're so popular these days. Your question is right on. I think it's extremely popular, important. And you can't just rely on healthcare professionals to say, hey, remind your patients to tell their first degree relatives that they should be screened for type 1. It just, as you know, it just doesn't work. Maybe where you live, but not out here in San Diego.
No, absolutely. I think the raising awareness and education is the key to it. Right. Time flies, Steve, as ever. So I want to thank you for your insights. Amazing, always with humor. And every single time I see you and talk to you, I'll always let a little bit inspired about what you do and sort of paves the way for a lot of us to learn as well. To all the listeners, I would encourage you to visit the platform, the TCOYD platform, follow it on social media, YouTube, etc. And have a look at some of the educational outputs. As we have said, with humor, but with good educational, it's for basically improving lives of those living with diabetes, talking about clinicians amongst ourselves. So thank you for that. And also to the listeners, just to remember what's coming next in the podcast, where we'll be interviewing Dr. Alice Cheng when she talks about the diagnosis and misdiagnosis of type 1 diabetes in adulthood. So we'll wrap it up here with a huge thank you to Professor Steve Edelman for his time.
Thank you, Partha. You're such a kind host. Appreciate it.
Thank you.
For more Bridge content on type 1 diabetes, including the latest events and initiatives, find us on Spotify, YouTube, and our website.